Hello friends, so today we'll be learning the arsenic poisoning. It is a very important topic and many questions come from this topic in university exams and PG exams. So we'll read it in detail.
And before that, let me tell you a story. That is a story of Napoleon's death. And here, interesting thing is when he was in exile, one of his ally used to give him slow poison, that is arsenic, in his food. And slowly he develops weakness. And one day, the lethal dose of mercury chloride is mixed in his glass of juice, and after 2 days, he died. Now, coming to the point, guys. So, arsenic itself is not a poisonous thing. Like when it is in metal form, it's a non-poisonous. But when it binds to the other elements like copper, it from copper arsenide, copper acetoarsenide, and ADO, arsenic trioxide, and the arsenic gas. These things are very poisonous. Among these, arsenic trioxide is commonly used in homicide. Now, how to identify these compounds? See, copper products are green in color, but there are different shades. Copper arsenide is Seal's green, and copper acetoarsenide is Paris green. There is little difference. And now, coming to the arsenic trioxide, it is also called white arsenic because of its color, because it looks like white, and it's also used in AML M3 stage. And due to its white color, it is used in homicidal poisoning, but it's not ideal like thallium. Now we'll be reading the presentation of arsenic poisoning. So presentation of arsenic poisoning can be remembered from the word itself, that is arsenic, ARSENIC, and each letter has its significance. So coming to the A means Aldrich line. It is a line seen in fingernails of arsenic poisoning cases. Suppose this is a finger and it's a nail, there will be horizontal white lines. This is Eldritch line. And there are some people called arsenophagist, means they use arsenic as a addiction for the libido performance, sexual performance, and they can intake around 300 milligram arsenic beyond lethal dose. Actually, lethal dose is 100 to 200 gram. You can remember it from the letter A is equal to 1, and that's why 100 milligram. Now, a arsenic poisoning cases we generally present with rashes, and when we cut open the stomach of a arsenic poisoning cases, we can see the red velvet color of the mucosa. In chronic cases, we see the raindrop pigmentation of a person. These are the depigmented white dot structure all over the body. I will show the picture later. Now coming to the S for subendocardial hemorrhage. Sub means below the endocardium, the innermost layer of the heart. Now, E for excessive hyperkeratosis. Generally, on skin there are keratin present, but here hyper means excessive keratin, and it shows as rough, patchy spots on palm and shoulder generally. And now, coming to the letter N for neuropathy, and especially peripheral neuropathy. And for letter I means iron oxide. It's a hydrated form of iron oxide which is used in antidote of poisoning of arsenic. There are generally two types of arsenic poisoning. Later I'll show it. So in acute arsenic poisoning, patient come with symptoms just like cholera with rice artery stool and etc. So on this picture I was talking about, this is hyperkeratosis, rough pigment, and these are raindrop appearance on the palm, and on the sole same raindrop appearance, and these are the horizontal lines on the fingernail that I have talked about. Coming to the additional features and the mechanism, this smells like garlic. It means garlicky smell. And lethal dose that I have already talked about, this is 100 to 200 milligram. And the target tissue from the arsenic poisoning is vascular endothelium. When people engulfs arsenic compounds, then there is a cascade of problem, and this problem affect the vascular endothelium and causes hemorrhage. One of the main point is pyruvate oxidase. This is an enzyme present in the mitochondria, and it has a sulfur group, and arsenic has a high affinity to the sulfur group. So arsenic attacks this SH group, sulfur hydryl group, on the pyruvate oxidase, and it disrupts the ATP production in the mitochondria. Not only pyruvate oxidase, it also attack on the nitric oxidase synthase. So in total, it creates oxidative stress and damage the vascular endothelium and causes hemorrhage, edema, etc. Now coming to the types of arsenic poisoning. First one is fulminant type, and second one is gastroenteric type. So what is fulminant type? When a person take a massive dose of arsenic, it can happen in the industrial settings or by a tragic case. And second one is gastroenteric. It generally happen in acute case and shows symptoms just like cholera, the same rice, watery stool, and etc. In fulminant type, the symptoms happens very quickly. First organ failures and then shock and then people die. And another thing can be noticed in the gastroenteric type, that is TVP. TVP means throat pain, vomiting, and purging symptom. But one thing to be noticed that doesn't happen in cholera, that is tenesmus. This pain and cramp feeling is not present in cholera. This is the only difference. And in the other additional features, we can see when a people exposes in the chronic poisoning of arsenic, generally the first and the earliest symptom is leukomelanosis. It means on the face there is a malar area near the cheek, there is a hyperpigmentation of that area. And another thing to note, in acute poisoning, the poison doesn't cross the blood brain barrier, it rather goes to the liver and it affects the liver and the metabolism. But in chronic cases, it rather deposit on the skin, bone, and the hair. And hair is used for taste, and the preferable hair is pubic hair, as there is a less chance of contamination. And another important thing happen in the chronic cases of arsenic poisoning, that is black foot disease. In black foot disease, there is a thrombosis and the obstruction when the sufficient blood doesn't reach in the lower part of the leg, and the whole area becomes blackened. And if this thing is unchecked, then it can progress into gangrene, and doctor recommend to amputate the leg. And last but not the least, it is the treatment. As I have told, there is an antidote called ferric oxide, but it's not a normal ferric oxide. It is a hydrated form of ferric oxide which is freshly prepared. And we do the gastric lavage. And as a chelating agent, we use BAL or British anti-leucide and dimer carpol. Thank you.